We have two speakers today, and they will do their presentation, and afterwards there will be time for questions. So first up is Johan Lidberg.
Yeah.
Welcome, and let's roll.
Yeah. So my name is Johan Lidberg. I'm a PhD student at the Department of Psychology at the University of Gothenburg. And well, the study I'm presenting is, there you go. What did you do? Okay. So it works now? Yeah. Oh, thanks. So the study I'm presenting is entitled Challenges in Emerging Adulthood Related to the Impact of Childhood Bullying Victimization. And so I'm also a licensed psychologist, and previous to my doctoral studies, I used to work as both, for some time, as a school psychologist and also in occupational healthcare. So I sort of have interest in this study in both ends, so to speak. It's a study conducted by myself, Dr. Sofia Berne, and Professor Ann Fresén, all at the Department of Psychology in Gothenburg. That's one start. Okay. So the negative impact of being bullied in school is not only restricted to the time of victimization. Studies has also found that being bullied in school is connected to long-term consequences in adult life and found in different dimensions of life, such as mental health problems and social relationships, employment issues and lower income, and also body image problems and even eating disorders. As can be understood from these studies, the long-term consequences of bullying are at risk of impacting several different dimensions of life, and as such, more qualitative studies are requested and asked for in order to retrieve a more in-depth and subjective experience of how these experiences of being bullied in school is related to adult life. A few studies that has interviewed adults on these questions have found that, for instance, social avoidance and feelings of insecurity are adult outcomes from these experiences. But what we believed was missing is how these long-term consequences might be related to the developmental features of emerging adulthood. And so emerging adulthood is the time in life between adolescence and adulthood, and it's situated between the ages 18 and 29. It's been described as characterized by the developmental features of identity exploration, which is the big one that is happening during this time of life. It's also a time of instability, increased self-focus, and a feeling of being in between. But it's also a time in life when there's an increase in mental health problems that happens at the same time as social and institutional structures are weakened. You leave your primary family and so on, and embarks on finding yourself, so to speak. So this time in life is also a time for navigating the development of one's self in relation to others. It's a time for finding new friendships and so on. So these aspects might then be, could be affected by the impact of earlier victimization. Yes, and for the present study we used the following research questions. Do individuals who were subjected to bullying victimization during their childhood school years and who have poor mental health today as emerging adults perceive a direct connection between the school years bullying and the poor psychological health they suffer from today? And how did they experience their victimization when the bullying occurred? And of course, the primary focus was what perceived consequences do they describe that these victimization experiences has had on their lives as emerging adults. So for the study, we used a purposive sampling procedure. The participants were recruited from the longitudinal research project Mobbning och skola, MOS. In English, that is Bullying and School. It's an ongoing longitudinal research project in the greater area of Gothenburg city. Started in the year 2000 when approximately 970 individuals were recruited, and since then there have been 7 data waves of it sounds a lot, doesn't it? So the participants we recruited for this study was 15 emerging adults, 9 women and 6 men, and they had both reported being victimized at age 10, weekly or more. And they had also answered on questions indicating that they suffered from poor psychological health in emerging adulthood. So these participants were then interviewed on their experiences from the time of victimization and also on the perceived long-term consequences of these experiences. And thematic analysis was used to analyze these interviews. What was found in this study was that almost all participants actually perceived a connection between the victimization they had experienced in school and the poor psychological health they suffered from as emerging adults. And these 2 quotes exemplifies what 2 of these participants described in this process. "I have a lot of social anxiety, and I think that's a direct effect of the victimization." And another participant said, "I repeat to myself what others have said about me, and it makes me sad, and I get stuck in negative and destructive thoughts, and I have had many episodes of depression." So, most of these participants described that the victimization had been going on for a long time. They had been subjected to bullying for, some even described it had been an ongoing process for their whole time in school, but most of them described that it had been going on for several years. What they also described was that much of the bullying that they had been subjected to was directed at appearance. And this could be facial features, or there could be stature, or, well, anything. They described it in a way that it could be anything that the bullies dictated as odd. So it could be anything, but most of them anyway described how the bullying had revolved around being called fat and ugly. So it was directed at the body. And they also described how exclusion had been a prominent part of the victimization process. This could be either by directly being told not to be part of what the others were doing, or it could be in more subtle ways of being left out or excluded. So these participants described that during these victimization years, they experienced depression, anxiety, and some even described suicidal thoughts during this time in life, which is, of course, alarming. What's interesting, too, is that they described that they tried to change things about themselves. They listened, but they wanted the bullying to stop, so they listened to what the bullies said, or what they thought that the bullies wanted. And they tried to change things about themselves in order to make the bullying stop. But as they described it, it didn't stop anyway, so it just continued, and they sort of gave up this process. It's also interesting and very important, and in relation to previous descriptions here, that what they perceived was that they didn't get any help from school personnel. And I emphasize that this is what they perceive. We can't know what the school personnel did, because we don't have data on that. But what these participants described was that no one saw, wanted to intervene, or acknowledged that they were subjected to bullying. This is a good quote that exemplifies how some participants described feelings of despair, of being locked into a situation that they could not get out of. "It was so hurtful. I was so helpless that I wanted to take a knife and hold it against my throat like this. I couldn't do anything about it. It was very hard to escape. That is, I couldn't master the situation, and it was very depressing." So moving on then to what these emerging adults perceived as long-term consequences from the bullying. Most of them, almost all, described that they had some kind of constant feeling of insecurity that they carried around with them all the time. And some of them even described how explicitly said that their identity were formed out of these victimization experiences, and they perceived themselves as worthless in a process that had continued from the victimization up to emerging adulthood. And as the bullying had been directed at appearance, they also had a lot of body image problems, and some even described eating disorders. Anxiety and depression, of course, they had been selected on these premises, so they talked about that. And they returned, and this is important, we believe, they returned to a feeling anger about school personnel who they perceived as not intervening. This was something that they really emphasized. How could no one had seen this? So based on these long-term consequences, they had also developed different strategies to shield themselves from further pain. And these strategies were social avoidant behaviors, and to some it's also meant that they had problems attending higher education, connecting to fellow students, or performing in work, or even sometimes leaving university. This is a good quote which exemplifies how they perceive their situation as emerging adults. So much of it, the bullying victimization, has been sort of integrated in me. Even though it isn't a part of my life anymore, I can see that it has sort of formed a kind of filter that all my thoughts have to pass through. So it's really formed the way I perceive myself today. And perceive myself also has to be understood then in relation to others. So, what these findings connect to is that they describe a long duration of victimization. They try to change things about themselves, but it doesn't work. So they're sort of stuck in what has been described in previous studies as a victim career that develops over time. And this is important to notice in relation to how they perceive that school personnel did not intervene or try to stop. And I emphasize again that it's how they perceive the situation then. In terms of how these findings from the present study relates to emerging adulthood and the developmental features of emerging adulthood, the mental health problems related to the time in life of emerging adulthood is described as not well understood in relation to the developmental features of this time in life. So navigating emerging adulthood with mental health problems from experiences of being bullied in school might then add to the problem of one's mental health issues not being properly addressed. Identity and identity exploration is the big thing that happens during emerging adulthood. It's related to almost everything that happens in career choices and romantic relationships and so on. But also in developing one's own identity, which is happening in relation to others. So the social avoidant behavior, they describe feelings of insecurity and also body image problems, and what some of them described in identity formed into viewing themselves as worthless is, of course, I shouldn't say, but it might become hindering in navigating the emerging adulthood. And the process some of them described in avoiding higher education is also related to what has been described as achieving adult markers of adulthood, that is, achieving accepting responsibility for oneself, making independent decisions, and becoming financially independent. So, in conclusion then, what the findings from the present study illustrates is that long-term consequences from being bullied in school might be better understood if it is related to the developmental features of emerging adulthood and what's happening then. The findings also indicate that school personnel should be especially attentive to bullying that continues over a long time, is directed at appearance, and where the victim puts much effort in trying to adjust to the victimization, as these aspects in this group, at least, seems to be connected to long-term negative consequences. And in relation to clinical work with emerging adults suffering from mental health problems, the findings indicate a need to address a possible experience of bullying victimization. This might be especially important if there are issues of body image problems or eating disorders to address this history. So, thank you.
Thank you very much. Next speaker, teachers' perception of their efforts in fostering parents' involvement in school bullying prevention. Džiuginta Baraldsnes from Norway. Welcome.
Dear participants of the conference, it's a great honor for me to attend this conference and to meet both researchers and practitioners who have a genuine interest in school bullying phenomenon and its prevention. My name is Džiuginta Baraldsnes, and I am assistant professor and PhD candidate at Western Norway University of Applied Sciences. Today, I'm going to present some results of an extensive study and talk only about one specific characteristics about teachers' efforts to involve parents in school bullying prevention. And this study is done in the framework of Olveus Bullying Prevention Program. In the last 4 decades, many various evidence-based whole school approach anti-bullying programs have been developed and implemented in schools. And an updated and meta-analytical review of the effectiveness of the school bullying prevention programs indicated that these programs were effective in reducing bullying perpetration by 19-20% and victimization by approximately 16%. The findings of the meta-analysis done by Toffey and Farrington in 2009 also revealed that Olveus program inspired 17 of 44 evaluated anti-bullying programs. And it should be admitted that Olveus program has been successfully implemented in many different countries. For example, Norway, Sweden, Iceland, Lithuania, and USA. And this program has been the main interest of the current study. And many whole school approach anti-bullying programs include parent training. Moreover, Toffey and Farrington indicated that programs which, among other components, include also parent training, was correlated with more successful significant reduction in bullying perpetration. However, the intensity of parental involvement differed a lot, from including parents into school bullying prevention only by sending letters home to really actively involve them as a community members to prevent school bullying on different levels on school, classroom, as well as individual level. And the involvement of parents has been reckoned as an important factor in school bullying prevention. However, the results the research about the parent role in school bullying prevention is still insufficient. And I really assume that Olveus program is a well-known program, and I'm not going into the core elements of this program, but I would like to emphasize that the main goal of Olveus program is to make school as a safe and positive learning environment in which adults display warmth, positive interest and engagement, and they are functioning also as a positive role models. Olveus program has a number of specific interventions on the 4 levels, on school, classroom, individual, in some context on community level. In the current study, only 1 component of parent training on the school level, 4 components of the parent training on the classroom level, and 3 components of parent trainings on the individual level of the Olveus program has been investigated. And as you can see, the aim of the study is to indicate possible differences among teachers in how they involve parents in school bullying prevention related to gender, teaching grade, age, and year of working as a teacher. And it was hypothesized that female teachers are more active in involving parents in school bullying prevention than male teachers. that primary education teachers are more active in involving parents in school bullying prevention than teachers from lower secondary education, that all the teachers are more active in involving parents in school bullying prevention than younger teachers, and the teachers who has longer experience as a teacher are also more active in this field than teachers with less experience. And in the current study, a non-experimental cross-sectional survey design has been applied, and data was anonymously collected through a standardized online self-administered questionnaire. The data of the teacher practices within the Olveus program were collected by applying five-point Likert scales with response options varying from "I do not do it" to "I do it very actively." And data collection was conducted in 2018 and was analyzed by using SPSS program. And descriptive analysis of a study and different tests has been conducted. Further, I'm moving on by providing a brief overview over teachers' respondents. And as you can see in the table, there were only 19 male teachers who participated in the study. More than half of the respondents had university bachelor or professional bachelor. However, 28% of the respondents indicated that they had another educational background, but they didn't specify it. The majority of the respondents were senior teachers, and slightly more than 4/5 of the respondents were primary education teachers. One-way repeated measures ANOVA indicated statistically significant differences between teachers' efforts to involve parents in school bullying prevention within Olveus program. Teachers put the most efforts in asking about bullying in the permanent conversation with a pupil and parents because actually they are obliged to do it according to the Norwegian Education Act. And teachers actively contributed to that the parents are to be kept well informed about the school bullying prevention work during at least one group or class parents meeting a year and during the regular parents-teachers conferences. In general, teachers were more active on the individual level than on the classroom level. And teachers prioritized most to inform and discuss about ongoing work against bullying at least once per year, rather than to invite parents to collaborate and to join the team to combat school bullying. And my sincere apology for such overloaded slide. However, I have decided to include this slide into my presentation in order to indicate significant differences in different teachers' efforts in involving parents in school bullying prevention. And I will briefly explain only the main tendencies of post hoc comparisons using Bonferroni correction. So firstly, teachers were most active on the school level of the Olveus program compared to all activities related to parents' involvement on the classroom level of this program. Secondly, teachers were most active within program in the meeting with pupil parents where they inform and discuss about ongoing work against bullying at least once per school year compared to other free teachers' efforts on the classroom level of this program. And thirdly, teachers were most active in the follow-up bullying incidents and having confrontational conversations with pupils who bully others compared to free teachers' efforts on the classroom level of the Olveus program. Further, an independent sample t-test has been conducted in order to indicate whether there was a statistically significant difference in mean scores for female and male teachers in efforts to involve parents in school bullying prevention. And the results indicated that female teachers put more efforts than male teachers in the follow-up bullying incidents and having confrontational conversations with pupils who bully others. The same test has been applied in order to indicate whether there was a statistically significant difference in mean scores for primary and lower secondary education teachers in their efforts to involve parents in school bullying prevention. And the results showed that primary education teachers put more efforts ensuring that report of what has emerged at the parents' meeting was sent out after parents' meeting to all parents. And in order to confirm or reject the third and the fourth hypothesis, a one-way between group analysis of variance was conducted. And there was no statistically significant difference in teachers' collaboration with parents on their classroom level scores for the 4 groups of teachers' age, as well as 4 groups as year working as a teacher. Therefore, both hypotheses must be rejected. And in summing up, I would like to say that teachers put the most efforts in asking about school bullying in the permanent conversations with a pupil and parents on the individual level, and in contributing to that parents were to be kept well informed about school bullying prevention work. However, teachers put the least efforts in involvement of parents on classroom level. And female teachers, in comparison to male teachers, put more efforts only in the confrontation and conversation with pupils who bully others. Primary education teachers, in comparison to lower secondary education teachers, put more efforts only in ensuring that report of what has emerged during the parent meeting was sent out to all parents. And the result of current study did not indicate any statistically significant difference in teachers' collaboration with parents on the classroom level and their age, as well as years of working as a teacher. And I included into my presentation the list of references in order to pay a tribute to the researchers who have contributed to research on school bullying in general and specifically to the current study. So thank you for your attention, and I would be happy to answer some questions.
Thank you so much. There are only 2 speakers in this oral session, so we have time for questions. If there is anyone who would like to ask one of you a question, you can raise your hand and I try to summarize. Yeah? I can hold it so you can.
Okay. This is directed more to your presentation. You had mentioned that it's very important for parents to be involved in this whole prevention plan. What about students that parents, they're not involved in the school? Do you think that that targets the students more? Because a lot of times it can be the bully's parents or the victim's parents that aren't involved in the prevention. So how do you get them involved? And do you think that it targets them even more? Do you understand? Yeah? It's a tough question.
Yeah.
I know.
Could you specify a little bit more? Because my study wanted just to show some possible differences in teachers' efforts to involve some parents, but of course I would try to answer your question if you could specify a little bit more.
It was mainly just your opinion. Do you think that, because I'm a teacher, I think we're all educators here, and when we have contact with parents, sometimes parents tend to not be as active, or kids come from at-risk homes. So if we want to include the parents, do you think, it's just your opinion, that students that don't have parents that are supportive would be targeted more at school, that they don't have parents that are supporting them in this? So if, for example, if you had something that they were supposed to work on at home, a bully, for example, and they're supposed to be working at home with bully prevention, and mom and dad aren't doing it with them, do you think it solves or targets that student more, or what are your educational thoughts? It's not anything that needs to be researched.
Yeah, okay, so I will not base with the results of the research, but I can say my own opinion, that if pupils have supportive parents, it's also a significant factors that the rates of bullying in school could be reduced. So this is my short answer.
Thank you. Another question, someone? I can hold it and you can...
Yes.
Yeah?
Yes, it's also a question to Džiuginta. Very interesting. I wonder, have you seen if there was any association between the teachers within each school when it comes to how they contact with the parents?
Thank you. No, I haven't done it because there were some schools where only 2 or 3 teachers participated. So actually, I think it can be it can be some difficulties also to reveal the results of this because. Because of anonymity of the participants. So I didn't look at it.
I can't remember how many schools you have.
It was 13 all-day-use schools.
Yes, because it could be interesting to see how much the school could affect these things.
Okay. I can hold the mic and you can talk to it, maybe.
My question is that one of your hypotheses focused on teachers' age, and what do you think it has some connection with bullying, the teachers' age, or you also investigated parents' age?
No, just teachers' age.
Why would it hypothesize? Because younger teachers sometimes they have a bigger wish to reduce something or do something. They have a higher wish to prove that they are good experts. So there are some reasons why I see that why I would support the hypothesis that younger teachers put more effort, and there are equally as much reasons for older teachers to put bigger efforts in bullying prevention.
So the question is about the age of the teachers. Yeah.
And thank you for this really very interesting reflection and at the same time question. And I would like also to refer to the study of Berger and his colleagues who also looked at the age of the teachers, and they found that actually teachers who are between like 40 and 45 years old are the most active in school bullying prevention because that they have a lot of experience as a teacher, so they learn how they can handle this phenomenon. And young teachers, they have a lot of energy. They can be very enthusiastic, but sometimes they lack an experience how to do it. And of course, if we are coming as new teachers, and we need to adjust, and we need to have some time just to learn how we need to work with this specific whole school approach anti-bullying program.
Yeah. So I think we have time for one more question if someone would like to. Okay, then I think we should give you both an applause and thank you for this presentation, both of you.